Howdy, this is a psychology and film assignment, Fictional Diagnosis by Rebecca Schultz, Avery Browning, and Liz Martinez. We did the movie Split, which is written and directed by M. Night Shyamalan. The plot is about the main character, Kevin, who's a man living with 23 different personalities. Kevin kidnaps 3 girls in a parking lot and takes them to the basement of a zoo. Some of the personalities are preparing room for the 24th personality, the Beast, who will help protect the other personalities and make the world believe that people with DID do exist. The girls are being held because they will be food for the Beast when the time comes. Throughout the movie, the girls are trying to escape before Kevin obtains this 24th supernatural personality. Most of the movie takes place in the basement of the zoo, where there are many different rooms in which the girls are held. This setting is important because it is the perfect place for the personalities to prepare for the Beast. Hedwig has his own room that is decorated just like you would expect a 9-year-old's room to be. There is also a kitchen and mudroom area. In this area, we see 23 different hooks with 23 different jackets and outerwear. This gives us some more insight on how each personality differs. Kevin also sees a therapist, Dr. Fletcher. Dr. Fletcher has many patients with the same disorder and often talks about her patients to the outside world in order to educate them. In the movie, she does a Skype call at a university about her patients. From this, we conclude that there is ongoing research about DID in the culture of the film. In the movie, Kevin has been diagnosed with dissociative identity disorder. The individual, Kevin Wendell Crumb, is a broken and potentially suicidal individual who suffered child abuse as early as the age of 3. His alternate personalities developed as a way to protect him. Dennis, the first personality to develop, is OCD and came into existence to help Kevin avoid abuse by his mother by being spotless. Dennis is part of the Horde, a group of 3 personalities who band together to assist the Beast in emerging. The other 2 members of the Horde are Patricia, an old-fashioned woman, and Hedwig, a 9-year-old boy. The Beast is the 24th identity to emerge and is supernatural. He is the embodiment of the characteristics of many of the animals in the zoo in which Kevin lives, and is also a cannibal. Some of the noteworthy personalities are also Barry, the artistic fashion designer who typically is in charge of who's in the light, Orwell, the history-oriented personality, and Jade, a kind female personality with diabetes. Past individual personalities and other symptoms of DID that Kevin experiences are blackouts, fugues, and amnesia. In the movie, multiple of the personalities claim that they're losing time and not aware of how they got places. Some of the personalities also keep emailing Dr. Fletcher, but Dennis, who thought he was in control at the time, has no recollection of this. This is particularly emphasized when Kevin is called to the light, and he demonstrates an overwhelming confusion of where and when he is, believing that it was 2014. Some symptoms commonly associated with DID that the movie does not demonstrate Kevin experiencing are substance abuse, self-harm, or self-destructive behaviors. In the film, Kevin is formally diagnosed as having DID as well as one of his personalities demonstrating OCD and is seen by his therapist, Dr. Fletcher. The cultural considerations of this movie are that while DID is recognized in many developed countries, many individuals, especially those who are uneducated on the topic, do not believe that the disorder truly exists. This is evidenced even in the culture of the film, as one of Dr. Fletcher's neighbors does not believe that her patients truly have the disorder. In uneducated and underdeveloped countries, it is possible that the disorder could be attributed to other causes such as possession, insanity, or simple deceit. There are many stigmas related to DID, many of which are shown or alluded to in the film. These stigmas are dangerous as they can lead to the individual with the disorder feeling ashamed of their condition and thus fearful of seeking help. As a result, they may not seek help or at least wait until the condition has developed to the point of becoming dangerous or debilitating. Stigmas with DID include that the patient is simply lying, the disorder does not exist, or that individuals with the disorder are violent or have schizophrenia. They also include that changes in personality related to DID are always obvious. There are 2 parts to Kevin's treatment plan. The first part is dialectic behavior therapy, or DBT for short. DBT is a therapy usually recommended for borderline personality disorder patients, and it's applied to DID patients with a history of severe trauma or abuse. DBT patients learn how to regulate their emotions, create interpersonal skills, self-motivate, reduce dysfunctional behavior, and create a structured environment for themselves. Kevin's suicidal feelings, thoughts, and history of child abuse make him a good candidate for this therapy. The second recommendation for Kevin is to begin taking antipsychotic medication, which is used to treat symptoms of depression and mania. DID patients report that this can either be beneficial or has no effect. Being on this medication will not eliminate Kevin's personalities, but it will help give him a sense of control and stability. DID is a relatively new disorder in terms of there's not much known about it. Because of this, there is skepticism about how beneficial DBT can be to DID patients. There's also fear among clinicians that you can diagnose and treat someone for DID when they do not actually have the disorder. The main barriers to treatment include the fear of treating DID patients and the fact that hostile environments for patients can halt progress that they've made towards getting better. This film fits into the broader perspective because the film accurately portrays how a DID patient's personalities can range in age, gender, vocabulary, as well as how culturally people are doubtful about DID. While this is true, the supernatural changes that occur in biochemistry seen in the film in relation to the personalities is inaccurate, and the film contributes to the stigma that DID patients are violent.